Hi friends, welcome back to my channel. Thank you for your tremendous support on the previous videos. Friends, do watch this full video. In this video, I'll be discussing about how to do basic life support, right? And differences between basic life support and ACLS, advanced cardiac life support, and the criteria for perfect CPR, right? So friends, beginning with basic life support. So what is the basic difference between basic life support and advanced cardiac life support? Basic life support does not need any health expert to be present. It can be given by any person who has acquired proper training in a basic life support system. And in advanced cardiac life support, it must need health experts, doctors to be present, and it is done only in advanced system. Name is only advanced, so it is done in advanced monitoring systems and which is available in tertiary care centers like medical colleges and multi-speciality hospital. Fine. So beginning with basic life support. So what happens when you do the basic life support? Okay, basic life support is done when a person falls down or in crowded place you see any RTA, you see a person falling down. You have to immediately decide what you need to do next, right? You have to save the life and each second is crucial, right? So first thing is you need to acquire whether it is scene safety, right? This is the first thing you need to note. Scene safety means you might have often seen people when such an emergency scenario arrives, people, some might be rubbing his legs and some might be uh, giving pushing person, so they may worsen the scenario, right? So what you need to do is you need to ask people to move away from the victim, and you have to tell them, make them confident that you are already trained in basic life support and you can save the patient, right? Along with the scene safety, you also have to give call to emergency response team. Emergency response team, right? Then what you need to do is check patient response, if patient is responsive or not. If patient is responsive, then fine, you need to monitor, okay, the patients until the emergency response team arrives or the ambulance arrives. And if patient is unresponsive, then immediately within seconds you have to check breathing of that person along with pulse rate, right? Now, you may have three scenarios. So let's begin with the three scenarios. If breathing and pulse rate both are present, breathing and pulse rate both are present, then you just need to monitor until the emergency response team arrives. If breathing is absent but pulse rate is present, then what you need to do? You need to give rescue breaths, mouth to mouth breathing, right? what is the rate of rescue breaths? You need to give one breath every 6 seconds. One breath every 6 seconds. And you may calculate using this that it may be 10 breaths per minute. 10 rescue breaths per minute. So these were the two scenarios, right? Now, final thing is, if both breathing and pulse rate absent, which is the most dreadful scenario, right, of person's life. It is most dreadful scenario. So, what you need to do? Immediately start with giving CPR. Immediate. Along with monitor breathing and pulse rate, right? Every 2 minutes. Keep giving CPR and monitor. You can take help of any other person in the crowd or any place where who may know the same, right? Or you may guide yourself then. So now what is the ratio? 30 compressions and 2 rescue breaths. You have to give, right? So 30 compressions you give proper, and then what you give 2 rescue breaths. And when till when you will continue the process? Until the emergency response team take over or arrives. Right. So let me summarize this. This is so simple. First, what you assured, scene safety. Then you give call to emergency response team. Then you check the patient response. You may tell patient, tap the patient, hello, hello, like this. If the patient responds, then fine, you monitor. If patient doesn't respond, then you check breathing, pulse rate. If both breathing and pulse rate is present, then you just monitor the patient until the emergency response team arrives. If breathing is absent and pulse rate is absent, you immediately start giving CPR, which is the most dreadful scenario. You give 30 compressions and 2 rescue breaths until the emergency response team arrives. And if breathing is absent and pulse rate is present, then you give rescue breaths, and one breath every 6 seconds is given as a rescue breath, or 10 rescue breaths per minute, right? So, this was about basic life support. Now, I'll be telling you the criteria of a good quality CPR, right? So now beginning with the good quality CPR criteria, right? There are few criteria for a good quality CPR, right? What's the rate of CPR per minute, right? For a good quality CPR, it should be 100 to 120 per minute rate, right? Then there should be adequate chest recoil. So there is adequate chest recoil in the while giving the CPR, and your elbow must not bend. After the criteria of good quality CPR, I will also put the video of how to give the CPR, so watch that too, right? Then what you need to assure that there is no excessive ventilation. There must not be any excessive ventilation, right, while giving the CPR. Okay, and adequate depth must be assured. Right, you must give adequate depth, like it is 2 inches or 5 centimeter approx. Right, so these were the few criteria for good quality CPR. So now I begin with advanced cardiac life support, right? So for this, you must know that it is given in advanced setting, and it needs specialists, it involves specialists to give, right, as intravenous access and all is required in this, right, and it is done in a proper setting like emergency of a tertiary care center, right? So let's begin. So we immediately start CPR when ATLS is announced in the emergency response system. And telling with my experience in the hospital which I did internship, they there I hardly saw any patient uh, uh, alive after a TLS procedure, because see, normally patients arrive in worse conditions only. So out of 10, only one survives, right? So it is the scenario, but still we need to follow the protocols and give them accordingly, right? So we immediately start giving CPR, right? We give oxygen, we attach monitor, defibrillator, then we assess whether the rhythm is shockable or not. If rhythm is shockable, then it is either VF or VT, and we give shock. And then we give CPR for 2 minutes, and we also, along with giving CPR, ask the health assistants or interns to give the intravenous access, right? And if intravenous access is not possible, because you have to save the life, so you give intraosseous access, right? Then again assess the rhythm. If rhythm is shockable, give shock. Then again do CPR for 2 minutes. Normally, in emergency of hospitals, what we do, we assign a person, like I give CPR for this time, the next time, next person gives CPR, because so many persons are there available in the duties in emergency care. So it's not an issue, right? We also administer epinephrine every 3 to 5 minutes, right? Then again we assess the rhythm, right? Again we assess the rhythm. If it is shockable, then we give shock. Then we continue CPR for 2 minutes, and we may administer amiodarone, right? Or lidocaine, whichever we get, and we treat reversible causes. Normally, friends, if a person you treat also, and even ATLS, you are able to save the patient, patient is given to ICU team, right? And there also chances of survival is minimum, right? So all depends on God, and you may already know famous saying, "Jakora ke saiya mar sake na koi." So that thing happens, and it depends on patient's destiny, right? Then if rhythm is not shockable initially, only after attaching monitor or defibrillator, then it is asystole, right? Or PEA, right? Then what you do, you give epinephrine. See the difference, friends. Here we rhythm was shockable, so we had to give shock, then CPR, then we did IV access, and then we, because here of course where rhythm is shockable, then chances of getting the patient back is more, right? If rhythm is not shockable initially only, then we stop all this step, just ask the IV access to be done, and then we give epinephrine as soon as possible, right? Then we give CPR, right? We don't give CPR first here. Then we give CPR for 2 minutes, right? Then we repeat epinephrine every 3 to 5 minutes, and we consider advanced airway capnography, right? Then we assess if rhythm is shockable or not, right? If rhythm is still not shockable, then we give again CPR for 2 minutes and treat reversible causes, right? So friends, basically we continue these all processes for more or less half an hour, sometimes 40 minutes, but rarely in an emergency you may see a person continuing these, because we all know the prognosis, but you have to, because we are in such a noble profession that we have to take the feelings of a person relatives, right? Because when it happens to one's own relatives, then you may know the consequences. So friends, hope it doesn't happen with anyone, but still life is all destined, so nobody knows what will happen when. So friends, we continue this, and finally we treat the reversible causes. So now I'll be telling you all the reversible causes, right? So copy it down. So friends, I'm telling you the reversible causes, right? So these 5H and 5T are reversible causes, right? So 5H, 1H stands for hypovolemia, then it comes hypoxia, then increase in hydrogen ion leads to acidosis, then it comes hypo or hyperkalemia, then it is hypothermia, right? And then 5T stands for tension pneumothorax, toxins, then thrombosis, which may be either pulmonary thrombosis or coronary thrombosis, and last is tamponade, which is cardiac tamponade. So, friends, this was the thing which I had in store for you today. I hope this video will be helpful. This is important, both BLS and ACLS, for the surgery part also and anesthesia part also. So friends, I wish this video was helpful. Please like and subscribe my channel for more videos, and do help me and you also, we both grow together as a family.